My name is Jason Robert. I have the pleasure of serving as director of the Lincoln Center for Applied Ethics, and I serve as senior ethics advisor to the University Provost here at Arizona State. I've been here a long time, 12 years, and very happy this year to be collaborating with the Institute for Humanities Research on their Medical Humanities Initiative. We have the director of the IHR here with us in the audience, Sally Kitch, recently announced university professor, and then we also have Associate Director Cora Fox, who's in charge of the Medical Humanities Initiative. I want to say a couple of words of thanks to Mary Drago, Nicole Piemonte, and Jenny Crayer. I waited until Mary was turning around and bent over before I introduced her. The nature of the embarrassment that I seek to bring people, but Mary, Nicole, and Jenny were actively involved in putting this panel together. We're very fortunate to have Priscilla Wald, who I'm going to introduce last, and she'll be giving a very important presentation this afternoon at 4 p.m. in West Hall 135. I think the talk is at 4:30 and the reception is at 4. So if you are going to go to that, you'll get a tiny bit of a preview of what an interesting dynamic scholar she is right now, but we're going to try not to cover any of the same material or too much of the same material in the sessions. And I'm going to start with introductions from the very far end of this table. Joan McGregor is a professor in the philosophy faculty of the School of Historical, Philosophical, and Religious Studies. She's been very active with the National Endowment for the Humanities, in particular recently securing funding for some summer institutes at the intersection of environmental ethics and sustainability. She's also a fellow in this year's IHR Monsters and Monstrosities Fellows Program. I'm also in there. I think I'm the monster. I don't know whether... Joan, you're probably not the monstrosity, but nonetheless. So we're very lucky to have Joan here. She works especially in moral and legal philosophy and has an extensive publication record on the periphery, but intersecting in interesting ways with the material that we'll be discussing today. To her right is Bert Jacobs. Dr. Jacobs serves as the director of the School of Life Sciences and as a professor of virology. He has been working at the Biodesign Institute here at ASU, and he's especially interested in developing a vaccine for HIV. One of the things that he's renowned for among students in particular is that every summer he leads a group of students to sub-Saharan Africa to teach AIDS prevention. Not age prevention, that would be also AIDS prevention to the international community. We're very lucky to have Bert with us. And then to his right is Celine Skupinski-Quiroga, who's a medical anthropologist here at ASU in the School of Transporter Studies, and has been very active in community-based participatory research with a focus on understanding and reducing health disparities. In particular, she has quite an extensive publication record, and on top of that, a true mentor to many students at ASU, so we're very glad to have her with us as well. And then last but not least, we have Priscilla Wald visiting from Duke University. Dr. Wald teaches U.S. literature and culture, and in particular has been focused recently on the ways in which law, literature, science, and medicine intersect. On a really terrific book-length treatment called Contagious, Cultures, Carriers, and the Outbreak Narrative. And she's also now working on a book entitled Human Being After the Genocide, or After Genocide?
After Genocide.
After Genocide. She's very active in the scholarly world, especially in American literature. Serves on the editorial board of Literature and Medicine. She's the editor of American Literature, and she has been a real treat for us to have here at ASU this week as part of the 10-year anniversary, 10th year anniversary celebrations of the Institute for Humanities Research. I'm glad that the Lincoln Center was able to kick in some money to supply some food and to bring everybody here, and again point out that there's plenty of food, so eat it. And I'm going to go ahead and get the panel talking, with some questions, but I'd like to open it up to you as soon as you're ready to jump in. So, let's start off with something very simple, very basic. What is this stuff at the intersection of scientific narratives and medical narratives on the one hand, and cultural assumptions and beliefs that lead us to think about the relationship between culture, science, and the other in the context of infectious disease? Why don't we start with you, Dr. Wald?
So the work that I do is, I'm trained as a literary critic, and I'm trained to read vast novels and complicated poems and things like that, and to think about how language, image, and story circulate and constitute lived experience. So why do we believe what we believe? That's the question that motivates me, and obviously there are many different ways of approaching that question. But for me, it comes down to the way that information circulates from specialty publications, science journals, law reviews, etc., into the mainstream media and popular fiction and film, and shapes the way we look at a problem. So in this case, what I've done with the Outbreak Narrative is I've looked at the notion of disease emergence, which came out of a 1989 conference in Washington, D.C., sponsored by a number of universities and institutes, where the people involved in this, epidemiologists, public health officials, and so on, wanted to change the way we were thinking. They had seen the way that HIV had circled the globe. It had captured the sanguinity from the 1970s that said, you know, infectious disease, communicable disease is going to be a thing of the past. That's not what we should be looking at. The CDC had turned its attention to non-communicable diseases like cancer or suicide, and we're not really thinking about infectious disease in the same way. But then there was HIV that punctured that sanguinity. And then they began to realize, well, Ebola, Marburg, all these hemorrhagic fevers, hantavirus that were surfacing all over the place were in fact coming from, they were all part of the same phenomenon. And they argued that these things were coming from a place that involved the way that development was working. So the world was expanding in terms of population. We were moving into areas where human beings hadn't lived before and were encountering microbes to which we didn't have immunity. At the same time, transportation was shrinking the world, and we had global corporations and people traveling all over the globe very quickly, and no place was more than 24 hours from a metropolitan center. So these things were producing this new threat to humanity. I'm almost done, sorry. And what these guys said is we have to think about this not as a medical problem entirely, but as a social problem and a geopolitical problem. We have to address the way we're living in the world. We have to think about development, how we're practicing it. We have to think about different modes of surveillance and how we're communicating, how we're traveling, and so on. And we really have to change the way we're thinking of this problem. But what I look at is how out of this conference emerged some vocabulary, visual and textual vocabulary, a discourse, a storyline that got picked up by science writers, the mainstream media, and eventually popular fiction and film. Representative film would be Outbreak, the Wolfgang Peterson, Dustin Hoffman, Rene Russo film. That's very classic of how this story gets told. And this very story did exactly the opposite of the message these guys were trying to get out. And so what I look at is how the way we tell these stories, I look at where they come from, I look at how they're shaping our beliefs and our understanding of a problem, and I finally look at what are the consequences of that. So in this case, the consequences of that are we're always thinking in terms of crisis. Are we going to survive? We're thinking in terms of apocalyptic narratives. We're thinking of the threat moving from the global south to the global north, expertise moving in the other direction, and we're stigmatizing particular populations, places, and behaviors, rather than thinking about this as a broader set of questions, as the 1989 conference attempted to do, and as the Alma Ata conference back in 1978 tried to do, which is to think about the ways in which global poverty is participating in this kind of crisis, and how we can't think about it only as, will we survive? That's crisis thinking. That produces a solution that consists of vaccines, quarantine, and drug treatments, pharmaceuticals, but doesn't think about changing our behavior, changing the way we think about the problem. So ultimately, my argument is we really need to look at the kinds of stories we're telling about these problems, and before we change our approach to the problem, or as a prelude to doing that, we have to change the story we're telling about that problem, hence the analysis of it.
Thank you very much. So I noticed some nodding heads on the panel. Does anybody want to jump in either with an extension or maybe a challenge to any of the things we've heard so far?
I would think an extension. I mean, all of it was very cogent, but the part where I saw that I fit in, work that I do, was about stigmatized populations. So I'm very also interested in narratives and discourse and stories, except my work tends to focus on the patient. Almost all my work has been with communities that historically have been marginalized. Since I've been here in Arizona, that means immigrants, undocumented immigrants, immigrants who've uncertain status. And so when they're in a situation of being diagnosed with a chronic disease or with an infectious disease or at risk of a disease, sort of how they are treated, how their own social experience of being diagnosed, of being categorized as having the disease. How does a medical discourse treat them as the other? And just now in the time of presidential elections, it was very easy to just, in thinking about this panel, turning on the news, looking at the headlines, and undocumented immigrants being the disease threat, carrying things over the border, and kind of this is a narrative that in my own work and trying to understand the context, a variation has been present since first contact. Where even though like first contact that we were, the colonizers were the ones bringing the disease, it was the fault of the indigenous for not being biologically sturdy enough. And kind of all the variations of disease and who are the carriers of disease and how is that a threat to the nation's state. So that context needs to be understood and to understand what are patients' experiences within the Western biomedicine, the medical care system.
Just one comment. The idea that, vaccines and isolation are not the answer.
Oh, no, I misspoke there.
Yeah. But I think they have a place in the midst of a crisis.
Absolutely.
When you're in the midst of a crisis, that's what you do.
Want, exactly.
But you have to prepare for that beforehand.
Right.
So that, do the sorts of things that, you're talking about to minimize those crises happening.
Exactly.
I think that's the key point, is that we tend to go from crisis to crisis to crisis.
Exactly.
Rather than doing the larger scale preparation that we need to do to prevent those crises from happening.
Thank you for that, because I think that's really important. I would certainly not say in the midst of Ebola that we shouldn't do quarantine, that we shouldn't be developing vaccines or anything like that. But there is a difference between the question of will we survive, which is the crisis narrative, and how do we want to live, which is the longer story that would minimize the need. And so I think we're totally agreeing with that.
And it's interesting because, as a scientist, we tend to think of the vaccines and the isolation, and it's harder for us to think a little bit more globally, but I think we have to start thinking more globally.
Yeah, no, thank you.
So Joan, I'm just going to pick up one thing that Bert was saying in particular. Toward the end of his comments, he mentioned that we've got to ask some deep questions about how we want to live in the world we want to live in. And I know with the work that you've been doing on sustainability, that's a question that you've been reflecting on as well. But feel free to comment on anything.
Well, I did want to say something about this idea of associating these infectious diseases with particular racial groups, and that, sort of historically, and just in our own state, and this is in my time since I've been here in the 90s with the hantavirus in the Four Corner region. Originally, the CDC actually named it the Navajo flu, right? And then they named it after one of the canyons there. And so those people, Navajo people then were associated as carriers, all of them, with this deadly, infectious disease. And so, it's sort of lessons, you think you learn these lessons, and of course the SARS virus in Canada was associated with Chinese people, devastated people in Chinese population, economically in Toronto. And, we can go back, sort of historically of all these accounts. So, I think, thinking about sort of how do we go forward and not think about these as kind of racialized other, right, as being associated. First of all, there's nothing to do with race with any of these diseases, right? And then how do we respond? When we think about quarantine, under what conditions you quarantine people, because you're really restricting all their liberties and they haven't done anything wrong, right? And so there's a kind of question of how it is as a society and globally we're going to think about problems of containment and quarantine and going forward. So that was just something. So yeah, I don't know if I can talk about the bigger sustainability question, but I do think that these, just thinking about how these, even when we kind of knew better, we still associated with certain groups and called it that, and even our own CDC was involved in that. So.
Right.
That's a nice point. One of the things that I was thinking about in particular is with hantavirus in the Four Corners region. It turns out that you can tell a very much more compelling narrative that has nothing to do with the Navajo flu and has to do instead with a decline in certain predators and the prevalence of certain rodents who happen to be vectors. And that's a very different take, and it's a take that's actually probably a lot more ecologically sensitive as well as culturally sensitive, but it's not the story that carried the day or carries the day.
Mm-hmm. And I think that's really important, and this is where I think a sustainability or larger environmental discourse comes into play. I don't think you can, the narrative that the 1989 folks were trying to tell is an environmental narrative as much as it's a global health narrative. I don't think you can separate those two things. Those are really deeply linked. But that thunder? Yeah, I'm with you. And it really, when people talk about the ways that environmental and racial discourses haven't been melded, they actually have been all along. It's just that the movements weren't. The environmental movement was a white middle-class conservationist movement, which is very different from an ecological or environmental critique. And if you go back and you look at the way that people have been talking about health issues, they've been very concerned about race and environment, the treatment of the planet and of people inhabiting it, each other, human communities, has been very consistently part, I think, of the larger narrative, the poverty narrative, that people have been trying to tell about these problems. And poverty, of course, is the other term.
Going back to the Four Corners, it turns out that was a particularly wet winter, and so there were lots of pine nuts. And so it's clearly there is the environmental part of it, and we may be seeing more of it. We don't usually get thunderstorms and rain in October.
I brought it from
Phoenix. But the other thing is that apparently the elders in the Navajo community said, oh yeah, every time we have a big rain, we get disease. And so I think one of the things we as Western scientists need to think about is that we don't have all the answers.
Right.
That the answers are often in the community, and that we need to talk to the community and say, what do you think about this?
Right.
Can you help us with this? Could we
Right.
help you with this? Could we work together?
People have traditions and stories that back them.
Stories make sense
They
a lot of
absolutely,
times.
absolutely. And I think, again, I want to push the poverty question as well, because obviously that is also part of what was going on, that the kinds of dwellings people live in, the access to medical care, the diet, all of those things contribute to the spread of an illness. Poverty is the single biggest vector that turns an outbreak into an epidemic and into a pandemic. And, it is it is not just, and first of all, first and foremost, has to be a humanitarian social justice issue. So that's number one. But even if you wanted to make an economic argument, it makes more sense to address these questions now than to try to deal with the catastrophe of an epidemic or a pandemic. And this is what we're seeing with Ebola. Look at the difference of people's survival rate when they got Ebola in the US versus when they got it in places where people don't have access to healthcare. And it's not that they're insufficient, I mean, it's not that the doctors aren't good, it's that they don't have access to it. So, and the same was true in Four Corners, is people didn't have, you know, the kinds of access to healthcare to take care of the problem, including making their dwellings safer from the rodent properties in the first place.
You know, whenever you think about infectious disease, and you're saying that the structural conditions that make it that it can flourish, and you can think about again, I was looking at headlines and so let's wait on Europe, so let's see what's happening with the discussion around refugees, and you know,
There it is again.
yes, in Finland, the population wearing latex gloves because they can get an infection. But then the response there has been, well, let's not talk about the population of refugees. Let's talk about the structural conditions around, you know, crowded conditions in refugee camps, about access to clean drinking water, and you know, so again, having the focus on those structural conditions that can be changed, that can be set up before, rather than the population, be it defined by, you know, immigration status or ethnicity or race, that they're the ones at risk.
But I also think you said something very important also in your first comment, which is that this goes back to the initial contact. And I think the other piece of it, and this is why I think the humanities has to be an important voice in this, is not just that we're stigmatizing people by saying they're bringing the disease. We are doing that, obviously. We've done that, you know, forever. But also that there is something about the contagion narrative or discourse that allows groups to represent themselves to themselves. And so I think that the idea of creating this other, of creating something that's at the border threatening the internal group, precedes in some way the idea that they're carrying this particular threat of contagion. Do you know, I don't think I said that very well, but I think there are two things going on. One of them, contagion, which means literally to touch together, becomes a way that people think about community. So one of the interesting things about contagion is that it represents, you know, a circulation of ideas. It was used for ideas before it was used for germs. So there is a sense in which contagion is a glue as well as something dangerous. So I think that's one point. But the other point that I think is what you're getting at is that groups, the way that groups emerge tend to need to find an other so that they can cement those internal relationships. And you have to mark that other as a threat. So whether the threat is terrorism, they're going to come from outside and destroy us and hurt us, or contagion, which really mixes. You know, once you get 9/11, the outbreak narrative becomes a bioterror narrative intrinsically, always. That there's always that first thing of, is this terrorism? And I think thinking about the kinds of stories that make us a group and the way that we need to stigmatize others to cement that group, that's a story I think we can work on changing, and that even precedes what kind of threat they're carrying. So you can't really address the threat of immigrants bringing contagion until you understand the deeper narrative of how are the immigrants threatening the internal group right from the get-go. Does that make sense?
Yeah, no, it makes sense. And so it's the idea of kind of policing your borders.
Right. And
so,
cementing your internal cohesion.
It is determining who is included and who is excluded social membership.
Right.
And so you can think about, so when you think about disease, at least from a medical anthropologist's point of view, medical disease, it's the body, but it's also affecting the body politic
Right.
and the social
Exactly.
body.
Exactly.
So it's a very powerful metaphor for as to who belongs and who doesn't.
And the danger of the disease narrative is that it has just enough grain of truth that it allows the dangerous social contagion narrative to take hold. Because it is true, obviously, that you have a population that has immunological, like herd immunity, right? That this population, you're not gonna have, you know, smallpox run through a population that has decent immunity to smallpox. Now none of us do, but whatever. You know, chicken pox, I don't know. Whereas a group, somebody coming in might introduce a microbe that, you know, to which we don't have herd immunity. So there's that grain of truth. It's not really real, but it's enough that it makes plausible the social contagion that you're talking about.
Well, and it's also how just kind of the general public understands some of these scientific concepts, the biological concepts.
Exactly.
I mean, I spoke not just a little bit earlier about scientific literacy and how as science advances, unfortunately, popular understanding of science is not keeping up. And so the way it gets filtered through the media, it's just a very diluted understanding of the threats and kind of how it actually happens.
Exactly.
We give an example of the other. I do HIV prevention education in Africa, and since in the US HIV is spread through anal intercourse, it spreads much easier through anal intercourse. I always ask the question of, does anal intercourse happen here? And people say, oh, no, we don't do that.
Right.
No. Well, maybe the people on the coast do,
Yeah.
but we don't do it.
Right.
And the people on the coast is code for Muslims.
Interesting. Yeah.
So it's them. They do it, not us.
Yeah. You've also pointed out, I think really importantly, one of the dangers of stigmatizing, which is that people won't admit something that is medically relevant because of the stigma that's associated with
The
it.
hugest issue with stigma is that it forces people underground,
Right.
and they don't acknowledge the disease.
And they don't come for treatment.
They don't come for treatment, don't tell anybody about it. The hugest issue is
Right. Right.
Well, and I guess, you know, one of the things that we talk about community and sort of who is part of the group and who's part of, not part of the group. And, you know, one of the things that we, you know, in some of the work, I've done some work in genomics research, population genomics research, and the ethics around using groups in that way. And it's just interesting how we sort of carve out who's part of what racial category, even though, on the other hand, we're saying really there is no biological, you know, race, but on the other hand, really, suddenly there is, right?
Right.
So there's a sort of like carving people up on, you know, lumping them into various groups, and then the effects, of course, of that research on, you know, the findings that, you know, may or may not come out of the particular samples they get. So, and it's a moving target, right? You know, who's part of our group? When we talk about we Americans, why do we Americans always look like, you know, white guys from, you know, I mean, it's like, why are those the Americans, right? Rather than this, you know, what in fact America looks like.
And this is why, I mean, this is something I'm working on now, and I'm sorry Bob left the room because the course we were teaching together last year had a lot of this. But this is why I think the ancestry tests that are so popular are so, one of the reasons they're so problematic. They're not even accurate, right? I mean, they're really misleading, and people find it kind of interesting. My husband keeps saying, I should do that. I'm like, you will not. But, you know, they're really not very meaningful, and they reinforce this notion that ancestry, first of all, that ancestry is even a thing, but also think about what the narrative is and what a genomic population is. It's something that exists at a fixed point in space and time. And so you could tell the story very differently. You can say, well, we're all out of Africa if you go back far enough. And there's a really interesting movie that I find very disturbing called Journey of Man. Have people seen this? My kids all saw it in like middle school and high school again and again and again. And it's very interesting, and they do the genetic tracing of, you know, all the different groups and whatever. But you hear the narrator say, you know, we're all out of Africa, we're all out of Africa, we're all related under the skin. And then he says, he's in Germany, he says, my relative ancestors come from here. It's like, wait, I thought we were all out of Africa. You know, so at a particular place in time, his relatives came from there, which, by the way, he didn't know from an ancestry test, he knew from family lore. But, you know, at this point in time, if you go back further, if you came closer, you would tell a very different story. If you looked at different kinds of DNA, you would tell a very different story. So I think we are reinforcing, as you said, bringing back that biological question of race precisely with these narratives. I think they're
And
really
sort of
problematic.
reinforcing this idea that you are somehow, I mean, I like when people do those and then they suddenly go, I discovered I'm really black, or
Yeah.
I'm really, it's like, rather than seeing identity as having this cultural component of being part of, whatever culture you grew up in, I mean, that's, a more representational notion of your identity. But suddenly, I mean, this is a way in which we give science kind of more credence. 'Cause
That's
it's like,
right.
this is science, so it's gotta be true,
There's
right?
a number on it, it's gotta be true.
Yeah.
Exactly, it's
Yeah.
empirical.
Right, yeah, whereas the other thing is, well, maybe, I've just made a mistake, the family I was in.
Yeah.
So, yeah, but I think that there's a kind of fluidity about, who's part of what, and of course, some of the work I've done with Native American groups, I mean, they form their identities, it's a cultural notions, right, stories, and being part of a particular group, not some external, and that's where, of course, that's where I think the science, we were talking about the kind of different narratives, scientists come in with a certain narrative about who you are. Oh, you're not really one of those people because we found it in your genes, rather than, who you identify with, what cultural tradition. So that's, when we talk about how these science and cultural narratives and assumptions come up against one another, and if we think about science as always being the truth, well, then we're going to kind of slam into, people's view, their cosmology, their view of themselves, their community, and that's a kind of a rub that we need to figure out how do we navigate that, and if we really care about respect for people, respect for culture.
I wonder if you've come across that. I have actually, Bob Gotigan, who was sitting over there, and we share a grad student who is now a faculty member who has been doing work on blood quantums and the way that these tests are messing with that, the Dawes lists and all of that. I wonder if you've come across the danger of those tests and how they're being used there.
Yeah, and of course, there's a lot of conflict in Indian country around there, because many tribes do use those.
Right.
Partly, suddenly people want to be Indian because there's some tribes have there's wealth around it and other kinds of things. But so there's a lot of controversy about whether you use that or not. I mean, traditionally, I think people, what I've heard is people, it was more of a cultural identity of using it. But yeah, there's a lot of controversy about whether to use that or not, or.
And this is, one of the implications of this, I think that's so important, is, if you've grown up your whole life on a reservation, living as Indian, et cetera, or whatever tribe, living as part of that tribe, the Cherokee or whatever, and you have a blood test that tells you you're not,
Right.
and in one of the big problems that Jessie Bardill is her name, Bardill, doing really interesting work. One of the problems she's come across is that a lot of the people who are descendants of slaves, right, that there was a lot of intermarriage, especially with like the Cherokee and the Choctaw with slaves. And that suddenly people are finding that that's their legacy, and what's happening there, and suddenly they're disaffiliated because of it, and so on. So if I've grown up, living as Cherokee, whatever, and then find out I'm not by blood, versus somebody who has not grown up with any thought of that at all, who suddenly finds out, oh, look at my blood, look what it says. Which, again, these tests aren't even accurate, because they only test certain DNA, not, you tell a very different story if you use different DNA. And suddenly they're going, well, I'm Cherokee, I'm going to claim, and this other person who has lived that life is not. I mean, what? That's nonsense.
At the same moment in time, it really is by nation, whether they are going to use genetic tests, whether they're going to use, federal designations, or they're going to use ones that they have historically used within their own culture.
Lived experience.
Yeah. And then, it was like, who gets to decide who gets to be a member of the tribe and for what reasons? Is it because you want the federal recognition, so then you get the treaty rights and other things, or is it just being a member of the tribe? But it's interesting how some choose to go the route of let science be the decider.
That's
Again,
right.
so kind of how science is being used for particular purposes, not always with the results that they want. Kim Tallbear
Yeah,
had a
yeah.
book about that, which is really interesting.
Yeah, but under like the NAGPRO, where they're doing repatriation, there it is a try to use cultural narrative to be able to repatriate their remains, not, part of this debate has been whether we'll say, well, we'll do the DNA test, but, like, you probably all know the Kennewick Man case, but that was, tribes were trying to establish that this is one of our ancestors, because we've got stories about people in this place, and we've been here forever, and, whereas the scientific narrative was, no, we're gonna come in and, do a DNA test and determine that that person is not part of your group.
Right.
Another interesting area, kind of moving away from the ancestry test, are the pharmaceuticals, which are marketed towards a particular racial group.
Vital.
Vital. I'm just reading your Edith's book,
I don't remember, but
I
yeah.
don't remember the title.
Yeah.
But it's also, in teaching a class, that is the evidence that students would always present as to why races really do exist. If races did not exist, there would not be drugs for them.
And there aren't. I mean, the whole story of Vital is that it didn't, it was to try again with the FDA. They had to come up with a new story.
Didn't they find
yeah.
a subcategory that worked on it? Just happened that those people.
And it turns out not even to be valid, it was just that small sample, and so now the drug is being marketed in a way that, it's crazy. I mean, it really is crazy.
If you
Follow
break
the
down
money.
populations enough, you'll find a subgroup
Yeah.
that something looks like it will work for.
Yeah.
One of the things in being director of the School of Life Sciences, that is hugely broad school, listening to some of my friends in biology and society and philosophy, one of the things that I think scientists have a tendency to say, we have the answer. And I think what we have to do is come at it with a little bit more humility, that we can give information and we may have part of the answer, but there's a lot more to it than what we have to bring to it. And it's that type of humility is the thing I think we have to be sure that the scientists in the future have.
Which is also part of the narrative is the role of science. Science has a particular place in the narrative. It's got a certain belief system attached to it that I think in a lot of interesting ways inherits religion, right? What the way people used to turn to God. And you can actually see this starting to happen in the 18th and 19th century, that there's a move towards, religion and science are in tension. And science is inheriting some of the authority that used to be the priests, right? The doctors are in a kind of priestly role early on. They even wore the same kinds of garments for a while in the early 19th century. So there's a really interesting belief system that's happening that I think informs a lot of the ways that we think about these issues. Should we maybe open up to?
Well, I was just going to say, clearly so many of you are starving right now. I highly recommend you go grab something. But I did see a few hands go up, so I'm gonna start off with Ben Hurlbut and make your question as loud as possible, please. So we
Or
can all hear
comment,
it.
doesn't have to be a question.
Oh yeah, or your soliloquy.
So my question follows on from the discussion we were just having, though in a somewhat obscure way. And the question has to do more with the cement or the glue than with the kinds of others that get constructed. One of the things, so your account of this 1989 meeting was that poverty is foregrounded as an important determinant.
Not so much poverty, development.
Or development, yes,
Yeah.
right. And that's what drops away in more popular representation. But it seems to me that itself is, that the construction of relationships that is in that more filled out picture is just as important as the stuff that maybe drops away. So as I recall, the first line of the book that came out of this meeting is, "Science, like viruses, know no country."
Microbes.
Science like microbes, know no country. Is that
No,
right?
microbes. Isn't it microbes like
Somebody
something?
get out the Google.
Anyway.
I'm pretty sure it's science like whatever
Virus, okay,
infectious
yeah.
agent
Yeah.
knows no
Sorry.
country. And there's, the work there is in part a construction of the way, to use Bert's phrase, to think globally. That is, what are the nature of the interrelations that make others of our global human community matter to us? They are brewing threats that warrant our attention, and therefore bringing them into our concern and intervention is necessary and appropriate. You know, it seems to me that there's that something as important is happening to the concept of poverty, but rightly, actually, as you point out, the notion of development, which
Right.
includes both the invocation of poverty and a tacit construction of the solution to it.
Right.
So anyway, I just wonder if you would comment on that, not so much the who is stigmatized as on the outside, but what is the us that is getting constructed
Exactly. And that's where I think contagion gets so interesting. So, you know, herd immunity becomes a kind of imagined community of sorts, right? We belong together biologically because we share this resistance together, and it's part of the cement of a community. In the case of, I mean, I did a very quick overview there. It wasn't the most progressive narrative imaginable, the 1989. It really was, it was much more about development in relation to surveillance. And I melded it with the poverty narrative, which was the 1978 Alma Ata narrative. And the Alma Ata narrative, do people know what this was? Alma Ata was a convention in 1978 that involved, I can't remember the numbers, but it was something like 159 nations, or 129 nations, I think, and something like 59 NGOs. And they all got together, and it was based on, actually it was based on Global South practices from Tanzania, from China, Venezuela, I can't remember where else, where the barefoot doctors in China, where they were sending people out into the community. They were redefining health in the way that the UN was defining health as a basic human entitlement, and as a broader sense of well-being, not just disease-free. And they were going into rural communities and saying, what do you need and how can we train you so that you're not getting tertiary medicine and having to travel to the metropole, you're getting, you know, primary care in your own community that responds specifically to your needs. And that was the logic of it. And the slogan was Health for All, and the idea was that this would be a universal access to healthcare would be a goal that all these signatories would sign on for the year 2000. I mean, it's laughable now, sadly, cryable something to look back at that. So that's the full picture of, you know, two very different discourses that were coming together. Your question of who's the us, I think, is very different in the 1989 conference and the 1978 narrative, which again was a Global South narrative. The United States and Western Europe actually diluted it because they felt it was too communist, right? So there was a whole politics going on for Alma Ata. The development narrative was much more first world, third world, and it was much more about surveillance. So the idea was, but it was also environmental, so it had some important components. The idea was not to stop the development or to rethink that, although some of the groups that picked it up carried it there, but rather to have surveillance so that the dangerous out there would not get into the populations that were sophisticated enough and advanced enough and civilized enough that we had conquered communicable disease. So even for this group of people, and they weren't as bad as the narrative that came out of it, but even for this group of people, the idea was HIV, Ebola, etc., was a representation of not having sufficiently surveilled to keep these things out of our border. And I'm not sure if that answers your question. The other thing, and maybe this was more your question, the other thing that interests me though is the way that things like herd immunity or contagion in a perversely positive way, right? That the danger gets turned into, in the narrative, a sign of connection. So that in a weird way, there's an ambivalence towards the contagion itself. So there's the herd immunity, which is positive, which says, you know, we're going to imagine our community through this biological means, but also a perverse way in which contagion shows people in contact with each other. And it gets picked up differently. This is getting too complicated because I can't give all the evidence that goes into this, but it gets picked up in an oddly positive way when the story gets, depending on what the disease is and who's suffering from it. And I'm sorry, I don't think that was very clear, but I think it might be an answer to, so that the we gets formulated, forget about what I just said, it's too complicated, but the immunity stuff works better. We gets formulated by those of us who have herd immunity, which is those who are coming in with these much more frightening diseases that themselves, because of the nature of the diseases, how they're spread, what the manifestations are, get marked as a particular kind of threat. So, for example, the flu is not going to be incorporated in this way. You're not, I mean, unless it's avian flu, which is a hemorrhagic fever. But the regular flu, even if it kills more people than Ebola, which it does in any given year, is not going to have the same anxiety attached to it that Ebola does. And it's because of the nature of the symptoms of Ebola and who gets represented as bringing it and where it comes from. And so that's the way in which a community marks itself as, you know, us versus that dangerous, poor, benighted, belonging to the past, primitive them.
Let me comment on sort of some of the glue in the HIV community. There are virus chasers,
Yeah.
who say, I want to get the virus because I want to feel like all of my friends have it, and so I want to feel what it's like to be part of that community.
That's right.
Now, that's only possible now because people are not dying in the United States of HIV, but it is people wanting to be part of that community.
That actually happens in genetics a lot. That people, certain genetic diseases get associated with family and community and really constitute a different kind of community. Or you could really see it among, say, the deaf population. You know, where deaf parents want to have a deaf child.
But you also see it in HD, in Huntington's disease, because there was this long-standing sense that this would be one of the disorders that people would be testing for and within families, and this would lead to an active reduction in cases in the future. And in fact, a lot of family members didn't want to know, in particular, they didn't want to know that they weren't susceptible, because if they weren't, then they weren't part of the family in the way everybody else was. So it's really remarkable dynamics there. Young woman in the back beside the camera, and say your name, please.
Hi, my name is Alexis Eustares. I'm actually in Joan's class. So I personally am a member of the San Carlos Apache tribe, which is about an hour and a half east of here. And so that's one of 576 tribes within the U.S. and also one of 22 within Arizona. And I just want to say I was a little thrown off by the wealth statement. I personally come from a district where 14,000 average income a year, so according to the 2010 census. And also 60% unemployment is just ridiculous. So soaring rates of poverty and, you know, alcohol and just domestic violence and also diseases. So I guess my question is, are any of you doing any type of work or, you know, plan on doing any type of work? You know, Gila River is 15 minutes from here and they have one of the highest rates of diabetes within the world. So I'm just curious if any of you have any intentions on helping.
Marius. Any thoughts on that?
Yeah, and I certainly, I mean, the poorest people in America are Native people, so I didn't mean to suggest that otherwise. I think that, I mean, one of the projects that I've worked on is, had to do with the, use of part of the Human Genome Diversity Project and sort of how that, what a debacle that was, because part of it was looking at, Native people, so selecting them out for research, and in our own state with the Havasupai people of, suggesting to them that we were going to sort of, look for these cures to diabetes. I mean, that's kind of what they thought they were getting out of being part of that research. And, and again, that's that sort of, when scientists come in and people have a devastating disease. I mean, this is, many Native communities now have, 50% 50% plus with diabetes, and it's a killer. That kind of research, you know, the fact that it might lead to some kind of cure would be so far down the road but the people were not really informed that that's what was going on.
Yeah, in fact, that's one of the challenges. So Mary Drago is sitting over there. Is going to be very humble about this. So I'm going to talk about it real quickly. Mary's master's project focused on the expectations of tribal members in the Tohono O'odham with regard to participation in diabetes studies funded by the National Institute. Pardon me?
Akamo.
Oh, it's the Akamo O'odham? Sorry.
Gila River. Yeah.
Gila River, okay. With regard to research funded by the National Institutes of Health, and in particular the National Institute of NIKKD, whatever that one is.
National Institute of Diseases of Diabetes and Diseases of the
NIDDK, yes. Diabetes and diseases of the kidney. And in particular, the expectations were on the part of many tribal members that there would be, in fact, health outcome improvements, dramatic ones from participation in the study, when in fact it's probably crystal clear that the most significant advances that came out of that research were advances in the careers of the scientists who had some nice publications out of it, but didn't in fact improve the health outcomes in that population. So we studied that for folks. I don't know if anybody else wants to jump in on the health disparities issue.
Well, I think this is an interesting point about, you know, how we think about disease and when you said, I mean, so much goes to, you know, environmental conditions, poverty. I mean, imagine if we focused our attention, you know, and our dollars in those directions
Exactly.
rather than at this other direction, so that, you know, because most, you know, like if you look at Native people in this country, you know, they often live in, you know, there's a lot of toxic waste in their environments, and, you know, in Navajo there's, you know, with the you know, toxins in the air and then the uranium mines and so on. So those affect those people's health severely, as with a lot of tribal land. And just poverty, you know, that's, and so it's a kind of different focus that we could, you know, put more of our attention to, but that would require seeing this connection between environment and health, and it's just
And telling the story differently.
Yeah.
I mean, that's
Yeah.
I mean, that's what I'm trying to argue,
Yeah.
right? That if we
Yeah.
told the story differently, we'd see the problem differently.
Yeah.
Not that, I mean, that's not the whole story. Obviously, there's tremendous politics involved in all of this. But I think before you can even begin to address that, you have to get at the root of why we believe what we believe. Because politics is always the next step, not the first step. And I think that's what often is hard to convey to people.
So I see two more hands up.
But by the way, the Journey of Man is coming out of the guy who did the Human Genome Diversity Project, and they were stopped by the ICPP, the Indigenous People Council on Biocolonialism. They blocked the research that this guy Cavalli Sforza was doing, and this film was his effort to make a kind of I'm tired and I'm losing the word, the polemic, you know, a sort of polemical case to reinstate the Human Genome Diversity Project. So it would be very interesting, I think, for you to watch that and see how they're reproducing that problem that you've identified.
All right, so David Lincoln, and then Clark Miller, and then Damien. Okay, David.
You mentioned epidemics and disease. Do species other than the human species experience epidemics and disease? And if not, why not?
Sure they do. I mean, like bananas right now, honeybees. I mean, we have
Yeah.
real problems. They absolutely, I mean, if they know their experience, you know, consciousness, I can't answer that question. but-
Bananas, we don't worry so much about the consciousness.
Yeah.
Rabies.
I mean, they're tremendous. I mean, that's how extinction events happen, is Dutch elm. I mean, that's a constant. And what's interesting is, again, how we tell that story. You know, is it a question of those species having their own rights, or is it about their relationship with us? You know, the whole honeybee question is about, and certainly bananas, is about how that will impact the human species. There are people making the argument that we should tell that story differently. I actually don't share that. I think if we tell it from a human point of view, we're more likely to do something about it, personally. But yeah, I mean, those are interesting questions.
And there are other interesting ways in which, especially with the sense of kind of zoonotic infection, that something plaguing non-human animal species could cross the species barrier,
There's always that,
to use a euphemism.
Avian flu?
Avian flu is an
I
example
mean,
there.
HIV, avian
Yeah.
flu, I mean,
Ebola?
everything.
Yeah.
All of new infectious diseases we see in humans start in animals and cross over
And it
the
came-
cross-species barrier.
Guns, germs, and steel, right? It
Yeah,
came from
yeah,
farming, from
yeah.
agriculture.
And actually, that's a segue. And one difference between humans and animals is humans have tended to aggregate into smaller into communities where we sit around and talk with each other, and if anybody in this room is infected, there's a decent chance it's going to spread. Animals tend not to do that. And so I think that's a difference between, you know, the humans and animals, that may be a difference in how epidemics are seen and how they actually occur.
And actually, the banana and honeybee are really very different, because the bananas have a disease, the honeybees, it's the chemicals that we're putting into the environment. So that's not, that's a separate, separate but related question.
Clark.
I was glad you returned, Priscilla, in your last comment to the argument about narrative design and the idea of constructing alternative stories. I don't think it's a simple problem, and it's one that, in fact, we almost do very little work on outside of fields of psychology and marketing, that where, you know, there's an explicit sort of strategic communication kind of framework, which I think is, in fact, generally not the framework that we want to bring to thinking about narrative design when we're talking about this kind of problem, because it's not a strategic communication problem outside of, as people have been talking about, the sort of real crisis moments where there certainly are strategic communication points. The challenge comes in, it seems to me, in what, at least so far in the discussion, has been an underprivileging of the political dynamics of these narratives. While certainly it is the case that there are narratives that propagate within the scientific and medical communities and within cultures, those are through very deep institutional mechanisms in constant dynamic feedback with relationship to the purposes to which those narratives or related narratives are put by political institutions at all sorts of scales, as Mary Douglas originally reminded us in Risk and Culture and other kinds of places. And that, I think, also reminds us that it's important not to romanticize the alternative narratives. China, for various reasons over the last 10 years, there's been the former head of the Hong Kong Public Health Service has been serving as Secretary General of the World Health Organization, and she has quite systematically been using the narrative that these infectious diseases are local and national problems to be addressed through the kinds of local and national capacity building that were reflected in the Alma-Ata narrative. For much to the worse, she's been far more successful at dismantling the emergency health capabilities of the World Health Organization than she has at actually building local and national capacities under that narrative, with one of the results being that the WHO was deeply unprepared in a way that 10 years ago it would not have been to respond to the Ebola outbreak in West Africa, to help those countries on the ground. And that's all because the political purpose of that narrative was to be able to dismantle an institution that many Asian countries viewed as infringing on their sovereignty. Right? So there are these deep political feedback loops that happen between these different narratives, and to sort of ignore that element of the construction and reinforcement of them at the cultural level, I think, is something that we, in the problem of narrative design, which I agree is sort of the sort of central policy problem of how would you construct an alternative narrative that could then inform a different formulation, not only of our cultural politics and our scientific frameworks and research, but also the kind of political dynamics that go with them. We have to think about it in that sort of integrated way if we're going to make those alternative narrative frameworks, alternative narrative designs work productively.
You're absolutely right, and I think one of one problem that I think people in the humanities tend to have is we want the perfect narrative in its place. And what we need is a better narrative, and then a better narrative, and then or a more just narrative, or we just need to keep thinking about that. And I think you're absolutely right that it's a lot easier to dismantle or critique than it is to put something else there. And you can't really do the first without doing the second unless, as you say, you want to have nothing at all, which is, and I think the other problem, you're absolutely right about the political service it's all put to, but it's not always apparent what that politics is, even to the people retelling the story. And one of the problems that I saw with the CDC, the WHO, all the non-response to the Ebola, the initial outbreak, actually was the flip side of the outbreak narrative. Normally, at least what I've looked at, the outbreak narrative creates too much fear and a kind of hysteria. And again, it's this, why are we so much more afraid of Ebola than flu, which is, really deadly? On the other hand, or car accidents for that matter, right? And, I have answers to that, but nonetheless. But what happened, interestingly, with the Ebola outbreak this time was that the narrative was so familiar to these people. Oh yeah, we've seen this before, it will be contained quickly, that they weren't paying attention to the fact that this was really different, that it was coming first in an urban setting, that it wasn't isolated in a village the way most of the prior outbreaks had been, and that it was going to spread that much more quickly, and all kinds of other political problems that they weren't paying attention to. And it was because of the familiarity with the outbreaks in the past and this outbreak narrative, I think, that the CDC and the WHO didn't jump in fast enough. And they've all conceded that they didn't. So I think you're making a really, really important point. I also want to go back, Ben, right, to your question, because I feel like I didn't answer it, and maybe that you were thinking about something you wanted to say about that.
Well,
Do you want to think about that for a minute?
yeah, sure.
Go ahead.
So thanks for that. So I come from hard science, so I'm going to articulate something, like I'm going to point to a problem, and I'm not sure I'm going to be able to effectively articulate actually what there is. So I work with Bert Jacobs, and we work with people in sub-Saharan Africa, in communities in East Africa, and one of the things that we're working on is building public health capacity. And so one of the interesting things about the problem of global poverty is that we're all working to solve it within the context of our cultural narrative.
Right.
Which
Exactly.
is that we actually are showing up there to do the work inside of our cultural narrative.
Absolutely.
And then it's just almost surprising to us that somehow development is happening with the same kinds of problems that we have here. And then we're all surprised by all the problems of industrialization in low-income countries when we're actually the driver for the development happening the way that it's happening. So one of the challenges that we face is the cultural narrative has us doing this work, but then what we recognize is that the solutions really have to be given by a community's own cultural narrative. And one of the things we're really good at is we're like inoculated from taking on anyone else's cultural narrative or incorporating, like there's something about Americans, right, where we have it like our cultural narrative is the right one. And that, we're...
I think that's pretty standard.
Is that true?
I mean, we have more power. We're
Yeah.
out there more.
That's
but
it.
I don't think we have
Yeah.
more of an intense cultural narrative than anyone else.
Yeah, so you just hit the nail on the head. So what happens is we show up, and by virtue of the power matrix itself, it puts us in a position where it's difficult to actually ascertain what would make a difference for the community in terms of how they would solve a problem, and they're actually not there. They're not self-expressed in their approach, right? And then we're trying to work cross-culturally in a way that's going to work for both communities, and we're stopped. And we're stopped by, we don't know how they would solve the problem. We're sort of open to their solutions, but their solutions are occurring inside the context of, well, how do you guys think it will work?
Yeah.
And you guys are sort of bringing the resources, so we need to kind of work with your approach.
It's
right?
also the other thing I think you're pointing to, and this is why, first, this is why you have to have teams of people with different areas of expertise. You need the economists and political theorists and the anthropologists and the, lit people and the, scientists and everybody all coming together and bringing their expertise. But you've also pointed to the fact that the nation is still so paramount in a global world, right? And that these solutions can't be contained within a culture. Everybody has to change if you're going to address this. So it isn't just like you guys figure out what you need in this context and we'll keep doing what we're doing. It's, if changes happen here, they're going to affect here and vice versa. So if what we're trying, we're very interconnected, and if what we're trying to do is change the nature of these larger political and socioeconomic questions, and geopolitical and socioeconomic questions, we have to think about the changes that we have to make in our own culture in order for the culture that we're going into to do what they need to do. So, for example, Paul Farmer talks about a really great example of, telling the story differently. And he looks at the COMS. Everyone know who Paul Farmer is? An anthropologist, medical doctor, who's done this really important work on HIV and multi-drug resistance tuberculosis, and he's worked in the most impoverished places and built state-of-the-art health care facilities and whatever. Not that it's perfect, but it's a different approach. And one of the things he talks about is he started in the Canche, which is a very impoverished section of Haiti. And he says everybody is talking about how crime and disease and et cetera is inherent in the Canche. And he says, but where did this happen? It started with, I think it was United Fruit. It was some major US corporation, and the alliance between that corporation and the Haitian elite in Port-au-Prince, and they put a dam in the, I'm blanking on the name of the river, but in the river that was running through this area that had really well-to-do subsistence farmers. Like people, it was arable land, people were making a living, everything was fine. Their land, the arable land, went underwater. They had to move their farms up the mountain into very non-arable land, and they became impoverished. So where do you put the problem? Is the problem right here, right now, with the poverty there? Or do you understand that there was a whole set of multinational incidents, events, decisions that created the situation in the Canche? And when you see it that way, one hopes, see the solution differently as well, the way that you have to address it. And I think that's really what you're getting at, and it's a really, really important observation.
Well, there are a lot of threads, I think, in the last two comments. One of them I want to maybe bring up with Celine. In particular, one of the, selling points of community-based participatory research is that we're trying very hard not to import our own cultural framework or our own worldview into the particular research setting, but to work to build collaborative partnerships with folks to have a better sense of their actual needs and so on. I'm curious to know if you want to say anything about that or about a more general issue, which is whether in fact we actually see any changes in the researchers and not just in the researched, and on the basis of community-based participatory research.
So actually, in thinking of your question, I was thinking of CVPR and I wanted to ask him how your team was set up. But there's difficulties. The idea is that you come in and you establish common ground and that the community knowledge and expertise is given the same way. And yet you have situations where they don't want to tell you because you're the expert. You're coming from the university. You have the resources. If you're going to bring NIH funding or what be it, tell us and we'll do what you say. And so it's very hard to kind of establish that equitable communication.
So it's like a deference.
Yeah, there's a difference, and it's around, I think it would be even more daunting in where there's such a power imbalance in terms of access to resources. It's really slow work. I have actually started working with people in the School of Art of Herberger and using something called a proof of concept process, which is before you launch your research study, let's just work on something together that doesn't have such high stakes, that we can actually figure out how do we best work together, how can you feel that you can communicate what your expertise is and it'll be respected. The thing is that's like a year of your grant.
Right.
And when it's a pressing issue, that has life and death consequences that, people can get iron. It's like, who has the time to do that?
Yeah.
So it also
Although-
is kind of establishing these long-term
Exactly.
relationships with communities. And also, it's not just coming in and working with a community, but then bringing people from that community to that they, on both sides, as an anthropologist, living in that community, not just kind of flying in, but actually kind of seeing what are the things, but also people from that community coming into your world, and that kind of helps with that,
Well, so this is
that back and forth communication.
absolutely, and it's really interesting because, of course, one of the challenges that we see is too often we end up making decisions about what research to do based on what we can actually do quickly enough because of particular kinds of career incentives. And that, we don't want to lose that year in our grant, but that might be undoing us overall. Bert, do you want to?
But that's also part of our cultural narrative.
Right.
We go in and we solve things.
Yeah.
And even if we try not to do that, it's sort of in the back of our head that we're gonna go in and solve something.
Yeah,
It's our cultural narrative.
right, that's right.
Other questions or comments, or can we turn it back over to Ben? Oh, Sally.
This is just, I've been thinking as you've all been talking, that one of the things we say in humanities is that, well, don't look to us, we're not gonna cure cancer, we're not gonna be, So, listening to you, I wonder if you've thought about, as you think about this narrative that you're not really maybe quite ready to do, but Bert says, we can't solve everything.
Right.
We want to solve everything, but science can't solve everything. And you're saying that, yes, actually, if you look back and you look into the history, and you look into the culture, and you look into the values, you see the changes there could actually contribute to a solution. That's a word we use around here a lot, which I put in. But anyway, let's just invoke it for a moment and say, a solution. How could we think about the humanities differently?
Yeah.
Through the work that you're doing, through the things that Bert has been saying about limitations and others, incorporating the political layers that contribute to the problems we're trying to solve.
Yeah.
Have you?
That's where I live, absolutely. I would say improve, not solve, because
Yeah.
once you try to solve, I think you just get overwhelmed. But, and I think it's an ongoing process, right? What I would call improvement, every step you're making is gonna change things in unexpected ways. So you need to keep thinking critically about the story and what's working and what's not working, and not think, okay, my work here is done, or, if we do this, it's gonna solve something. But I do, I have a slogan that, I modify, but I say to my students, if you change the story, you change the world. And what I really mean is, if you change the story, you begin to change the world. And that you can't, that to me, this is where looking at the problem begins. So for example, you can't, to me, have an ethical debate without asking, why do we believe what we believe? You can't start with what we believe and discuss the ethics of it. You have to go back to say, but why do we believe that? And what has circulated? And do we actually believe the thing that we believe? So to me, that's where it starts. And then the next step might be the ethical or whatever, and the different way of addressing a problem. And the line you quoted, which is right, I wasn't correcting you, I was starting to say, and there were several books that came out of that, and what I was starting to say is, microbes crossing borders is like the beginning of every outbreak narrative. The idea that you cannot stop the microbes, and every single one, it's like you have a quarantine and someone gets through, right? And so that idea, and what you were saying, that science like microbes knows no borders, the whole outbreak narrative is in that quotation because on the one hand, that's what I was saying, the danger moves global south to global north, and then the expertise moves global north to global south. And this is exactly what everybody's been talking about on this panel. That's the beginning of the story that you need to change. That we are so interconnected, and that the problem doesn't begin with the microbe crossing borders. It begins long before that, with the geopolitical structures, with the socioeconomic structure, system, that if we're going to make a change somewhere, it's going to have ripple effects everywhere, and we have to be willing and ready to make those changes. And I do think that people in the humanities, what we study, what we learn from the texts that we're reared on, let's say, is how to think about the way those narratives are circulating and how they can be changed, and when they are changed, what kinds of really deep effects you can make with those changes. So, there was a part of me when I started doing this that thought, God, what I'm doing is applied humanities or something. I mean, it's, and I really do think that it has to be at least part of the conversation. Where the narrative of race that feeds racism, where is that coming from? You can address it where it lives now. You can address behaviors, but getting much deeper at what people believe and why they believe, which I don't think is only a psychology question, though partly. It's a narrative question. It's a discourse question. And also art historians, it's an image question. Our imaginations are shaped by what circulates around us. It conditions the way we think, and it's changeable. But the change, but again, it's not, I would never say like, okay, once I do that, the job's done. There's politics, there's economics, there's, the way power operates, all of those things. Science, I'm not a disbeliever in science, right? There are, microbes that cross borders, and I don't want them finding me. But I think that all of these, that's why it has to be a cross-disciplinary conversation, but it has to include humanists in a way that it hasn't.
And as you know, we are uniquely set up at ASU
Yes, you are.
to be able to do those sorts of things.
And I've
So
been using you guys as a model, I do,
Yeah.
trying to get people to
that-
change.
it's part of our narrative,
Yeah.
if you will, is that we work
It's
interdisciplinary.
really exciting.
So the next step is to get humanities in on the grants that you write.
Well, let's start talking about it.
Bob Kothegen, I was on all of Bob Kothegen's grants, talked to Bob Kothegen about putting, and Hunt Willard, who was running our Institute for Genome Sciences and Policy. These guys really, really got that they wanted people who study the humanities, English people, art historians, not just philosophers.
And we want to get ethicists on, some of our life sciences grants that are
But I
going.
wanna-
We need to be doing these things.
I think one of the most important things for me is a distinction between ethicists and the humanities that I'm talking about. Not one is instead of another, but often when someone says, yeah, humanities, it's bioethicists. What I'm doing is not bioethics. I'm talking to bioethicists, but what I'm doing is narrative analysis and discourse analysis. And to me, that has to precede ethics, because ethics begins with, well, what do people believe and what do we therefore consistently need to respect? First, why do people believe that? And should we address the problem there before we honor what they believe?
So it's noteworthy that the Lincoln Center for Applied Ethics at ASU is premised on the idea that narrative reflection is the absolute critical starting point for
Yes.
any kind of ethical
Yep.
reflection. And we're grateful to David Lincoln, sitting in the audience here, who gives us all our money and paid for lunch today. I'm gonna take a moment just to thank our 4 panelists, Joan McGregor, Bert Jacobs, Celine Scapuzzi-Quiroga, and Priscilla Wald, as well as Mary Drago, Nicole Piemonte, Jenny Crayer, Cora Fox, who ran out, Sally Kitch, David Lincoln, the whole crew for putting this thing together. But I really want to thank you all for being here with us.